Full of emails from, I think I've had 4 emails over the past 48 hours from some of you who are trying to get onto the website for the homework and weren't able to get on. The reason why you weren't able to get on is when I set up the website, they require me to have a period of time that you're allowed to sign up for. And I think I picked the 1st of February. So if you tried signing into the website after February 1st, the website's gonna basically tell you no. So what I've done is I've gone back and I've extended the sign-up date to the end of this week. So, and that was effective 11 o'clock last night. So if you haven't gone onto the website, or if you've tried to get onto the website and it wouldn't let you get on because you didn't sign up for the website prior to 11 o'clock last night, you should be able to do so now. If you've already signed up and already were registered with the website, nothing changes for you. The homework should due sometime next week, I think. Yeah, sometime next. I think it's the Tuesday of next week, I think, Wednesday of next week. So that's homework assignment number 1. Today what we're gonna do is we're gonna finish up the skin. We're gonna do a little bit of the skeletal system. I only wanna get through the easy parts of the skeletal system. And then what we'll do is we'll take the quiz here in lecture. And then in lab, what I'm gonna do, because we don't have any really new material for lab. And I know that if I just went to lab and said, do whatever you wanna do, most of you wouldn't do anything productive. So what we're gonna do instead is we're gonna do a review. And the review's good because not only do you get a review, but you can actually earn points towards your test if you're there and you participate. So that's what we're gonna do in lab today. It'll be a real easy lab. It should be fun, either that or you'll hate it. Either way, it doesn't matter. I'm gonna have fun. So we left off talking about the sweat glands, which moves us, and we're talking about all the different components of our dermis. We started with the epidermis, talked about the cute Latino guy, sexy butt part, then we moved down to the dermis and we talked about sebaceous oil glands and our eccrine and apocrine sweat glands, where we find those. The next thing that we find in our dermis is going to be our hair. Our hair ultimately has its roots within our dermis. When you think about the function of our hair primarily is designed to protect us. All right, it protects us both from the effects of the sun, it protects us from bugs as they try to get onto our skin and make entrance into some of our natural orifices. Ultimately, when we think of our hair, if we're looking at the surface of our skin, epidermis here, this would be the dermis. We have the bulb, which within it has the root, and the root extends up to the surface of the skin, after which we refer to the hair as the hair shaft. And I know we talked about this a little bit in lab on Thursday. The hair does have its own muscle. This is called the erector pili muscle. And again, we talked about this in lab on Thursday. We talked about the job of the erector pili muscle being 2 things. One, it helps to dimple our skin, which we refer to as a goosebump. It also helps our hair to stand on end, which for most animals, it makes them look bigger. We don't really need to look bigger. So for us, it's really more of a way that our body can kind of signal to us something's up. And it kind of gets us at attention. It usually happens when we're under some sort of potential distress. I don't want you to get overly involved with the different components of the hair. I put it in the notes and then I never ask any questions on it. Nor do they do it in the lab. Our hair does have its own unique color. Our hair color comes from the same cells that ultimately give us our skin color, which are melanocytes. And we see melanocytes here surrounding the root. And so as these melanocytes secrete their melanin, our hair gets the same color, the same coloration, just like our skin does. So it's melanocytes that give us our unique hair color. The next one is the nail. The function of our nail is also protection in 2 ways. One, nails help to protect the tips of our fingers and help to protect the tips of our toes. We also use nails from a protective standpoint because they allow us to better grasp things. If we were bears, our nails would be claws, right? And bears use claws as a protective mechanism, and we would do the same thing. Ultimately, our nails are modified keratinized epidermis, which has become hardened and scale-like. And then as that grows out on the skin, it gives us a protective covering to the tips of our fingers and toes. And when we think about our nail, there's a handful of components, which are best shown by seeing a picture. So as you look at the nail from a bird's eye view, the portion that you would normally think of as your nail, that's called the body. The part that you bite off, that's called the free edge. As we move back in the nail, all of our nails has a little white portion right where the nail hits the skin. That's known as the lanule. And as you look at it from kind of a side view, the nail actually extends into the finger or toe, ultimately creating a root. This is the portion of the nail that ultimately gets created from the epidermis. And then as the nail extends out, there's a little section of the nail known as our cuticle. And the cuticle, everybody here knows what a Zamboni is, right? Mm-hmm. If you don't know what a Zamboni is, go to a hockey game. A Zamboni is that big machine that they use to smooth out the ice in between periods, right? The cuticle is to the finger what the Zamboni is to an ice rink. The job of the cuticle, as that nail comes out, is to make that nail nice and flat on the surface. When you bust up your cuticle, ultimately you're going to have ridges in your nails because the cuticle won't be there to do its job.
Look at that. You learn something new every day, don't you?
There it is. Right? Everyone's heard of the cuticle, but no one really knows what it does, I guess. And then the side, we have what's known as the lateral edge. And that ultimately helps the nail to stay fitted on the tip of the finger. Has anybody here ever lost a fingernail? I bet you nobody can beat the stupidity of my story, but I do want you to try. I lost this nail. I had the dumbest, I did it in the dumbest of all fashions. How'd you lose your nails?
The first time I lost a nail, it was because I most of the time I wear big acrylic nails. So my first time was playing volleyball in gym class, and then the second time was not too long ago, well, a year ago now. But it was just at work. I was lifting a box and it just slipped out my hand.
So those are good ways to lose nails. You know, they were trauma induced. Someone, did you lose a nail?
Oh no, mine are tough as I don't know what.
I lost mine because of spaghetti.
Oh no.
Yeah, spaghetti. I was, my wife cooked spaghetti one night, and I was cleaning the pot, and I was trying to put that little, you know, the pot always has that one straggler that didn't make it to the strainer, and I was trying to knock it off, and I went like this, and the piece of spaghetti went right up underneath my nail.
Oh, wow.
Like right here, and all the way back to here. And I literally pulled it out, and spaghetti was like out to here. The problem was, once the spaghetti got underneath my nail, it went to 98.6 degrees, so it cooked all over again, and it got soft. So as I tried to yank it out, there was still spaghetti underneath my nail, and it caused my nail to split. And then ultimately you lose your nail. But then the good news is most times when you lose your nail, as long as you don't mess up the root of the nail, that nail will grow back and it'll just be normal. Now you'd never know. I lost my nail. My mother recently lost her thumbnail because she decided while she was sewing to sew her thumb. And the needle went right through her thumb, and it actually got embedded in the bone of her thumb. And the needle broke. And so she actually had a piece of nail sticking in her bone of her thumb, like so. So she had to have a surgeon go in and remove it. She lost her nail, and it'll grow back in time. So our nails do grow back, as long as you don't mess up the root of the nail. If you do that, then sometimes the nail doesn't grow back. And sometimes when you mess with the nail, it comes back and it's a different color. My father lost his toenail, and to this day, his right big toenail is jet black. I mean, jet black. It's awesome. He doesn't wear flip-flops anymore. some of the different, every chapter talks about what's referred to as homeostatic imbalances. It's just a fancy anatomy and physiology way of saying diseases. These are diseases of this particular organ system. So, some different things that happen in the skin that are disease-based processes. One of them is athlete's foot. This is ultimately caused by a fungal infection that gets usually into people's feet. Usually it's athletes wearing cleats or some sort of tight shoe where they're sweating a lot within that shoe, which happens when you're doing athletics, unless you're not doing it right. And ultimately this causes the skin to peel and itch. The problem with this is it tends to come back again and again and again and again if you don't treat it properly the first time. Boils and carbuncles, these are when the hair follicles become inflamed. And it creates almost like, it looks somewhat like a zit. But what ultimately is happening is you actually have an infection or inflammation in that hair follicle as the hair is trying to leave the skin, and it gets filled with bacteria. And that's what causes you to have these different boils, cold sores or fever blister. This is a herpes thing. Did everybody here see The Office?
Yeah.
Where Michael, what's his name, thought he was going around telling all of his ex-girlfriends that he had herpes because he had a fever blister or a cold blister. We all have the herpes virus within us, and if it expresses itself around the mouth, we call it a fever blister. Some other ones, contact dermatitis. Contact dermatitis is when your skin is exposed to a substance that causes your skin to have an allergic reaction. All right, so this isn't caused by bacteria or viruses per se, but you might be allergic to, a good reason for contact dermatitis is people will get that when they're using cleaning supplies. Certain cleaning supplies which have a lot of heavy chemicals in them. You get that chemical on your skin will turn red, the skin will sometimes swell and become really irritated for a while. So this is just when you expose your skin to something your skin gets an allergic reaction to. Just tells you don't use that stuff anymore. Impetigo is a bacterial infection. Happens around the mouth. And they're these little fluid-filled blisters, for lack of a better term, that happen around the mouth. Again, this is bacterial. And then psoriasis. We see psoriasis a lot. You'll see psoriasis a lot. Psoriasis is rough. These are going to be white, silvery, scaly patches on people's body. I've got a lady who comes in and sees me once or twice a month, and she has the worst psoriasis I've ever seen. I feel terrible for this lady. She has it everywhere. Both feet, both legs, at least to mid-thigh. Both arms, she gets them on her hands, she gets them on the back of her neck, and she's there. And because she doesn't have a ton of money, she doesn't have the ability of treating it. And so, because the drugs for it aren't that cheap, and she doesn't have insurance. So, this is a rough one. You'll see this. This is usually, it's usually trauma and stress induced when you have it, and then this woman's always under a lot of stress. And it's a rough, it's kind of a rough thing to see. Here are some examples of them. This is what psoriasis looks like, where they have these white silvery scales on their skin. Impetigo, now what you're going to have are these little fluid-filled lesions, usually around the mouth, sometimes going up into the nose and cheeks. And then we've all seen what a cold sore looks like. Just some examples of some of our skin issues. We talked about burns. Do we need to go over burns again? We're good with burns? Here are just some examples of those burns. We talked about sunburn being a good example of a first degree. You're going to have blisters with second degree, and then complete burning into the deepest layers of the skin with third degree burns. The last thing this chapter talks about is skin cancer. Skin cancer comes in a couple different varieties. Skin cancer, there's 3 key varieties that we see, which range everywhere from, what are you going to do, to, oh man, this is really bad. Skin cancer has a wide variety of severities, all right? I've always said that if the good Lord came down and said to me, you have to have cancer, but you can choose the cancer you get, one of the skin cancers is the cancer I would choose to have. On the same token, if the good Lord came down and said, you have to have cancer, but you can choose 5 cancers not to get, there's a skin cancer that would be on that list too. They're very, very common in human beings, simply because we are so heavily exposed to the sun, and sun exposure is the key risk that ultimately gives us the chance of getting skin cancer. So when you think about them, there's 3 varieties. There's basal cell, there's squamous cell, and there's malignant melanoma. Each of these 3 are skin cancers that range from the least serious on the top to the most serious on the bottom. I personally have had this one. And when the doctor told me I had it, I was like, all right, what are we gonna do? Well, we're just gonna scoop it out. It's a good plan, let's do that. Malignant melanoma, when you get it, there's times where they tell you, here's how many months you have left, right? Because this is too far gone. Basal cell carcinoma, as the name implies, basal cell, this arises from the stratum basal of our epidermis. So as these basal, the cells of the stratum basal of our epidermis, which are the cells that are constantly undergoing mitosis, as they're producing more and more cells, if they mutate and produce an abnormal cell, we refer to this as basal cell carcinoma. These are going to be small little lesions that you'll see on the skin. Out of nowhere, you'll see kind of a lump on your face, or you'll see a lump on your ear. Like, man, I didn't have that 2 months ago. Then you'll watch it. They usually don't get any bigger, but you'll always see them there. If you go to a dermatologist and you're like, man, I don't know about this little lump over here on my skin, they'll look at it, they'll usually take a little sample. They'll find out that it's basal cell carcinoma, which kind of looks something like so. And then with the treatment for it, it's actually very, very simple. They just scoop it out. I've had one on my ear. I've had one on my right shoulder. There's no treatment after they cut it. And here's the other thing, you can live with it. Let's say you just decided, I don't want to get this taken out. All right. This is a cancer that is very, very benign. All right? It's the least malignant and by far the most common of all the skin cancers. Again, the treatment for it is very simple. They either burn it off, they freeze it off, or they've got like what the dermatologists have, it looks like a little melon scooper. They just scoop it right out, send it to the lab, find out that they got all of it, and then you're done. The worst case scenario is like if it's right by your nose, is sometimes you'll have a little like divot in your nose, and maybe you get a little plastic surgery to fix that, but no big deal. These are not horrible, horrible cancers. By far, one of the best cancers you could possibly ever get. The next one is called squamous cell carcinoma. Squamous cell carcinoma, what does squamous mean? Flat. So this arises from the stratum spinosum, which is the part of our epidermis where the skin cells start to flatten out. Hence how it got its name. They kind of appear as these red, scaly lesions on the skin. It almost looks like, you're like, I'm not sure if that's a contact dermatitis or what the heck happened? They usually itch. These are pretty easy to get rid of as well, all right? Early removal, and usually these things are much ado about nothing. The problem is these cancers can metastasize, and when they do, they like to go to the lymph nodes. If they get to the lymph nodes, they've got access to your bloodstream. Squamous cell carcinoma doesn't usually kill folks, but it definitely makes their life miserable for a long time. I've had a few of these walk into my office. All of them ultimately got cured of squamous cell carcinoma. All of them had to undergo some sort of radiation, whether it's a radiation cream or whether, but all those folks, it took years, 7, 10 years, where they would get rid of it in their arm and then it would show up on their leg. Then they get rid of it in their leg, then it showed up on their side. Then they get rid of it on their side, now it shows back up on their shoulder. And it kind of looks like so, what you see on the inside of this, I'm assuming, gentleman's ear. So it kind of has this scaly, kind of patchy lesion. And if this gets found in certain spots, people actually ignore it. They just think, oh, well, no big deal. They'll pick at it, you know. We as human beings are kind of a weird group. We pick at stuff instead of, that's not normal. Again, you catch this early, and the cure for this is really not that difficult. Then there's the bad one. This is the one that you hope you never, ever, ever, ever get.
On the last slide, what does, the one before that?
Oh, metastasis.
What is that?
That means it spreads. So if you have cancer that starts on your skin, and then out of nowhere, you find it in a lymph node, that means that cancer has spread to the lymph nodes. The spreading of a cancer is referred to as metastasizing.
What would happen if they don't treat it?
This one,
Yeah.
it'll get worse, and it'll kill you eventually. This will kill you eventually. Because again, it will spread to your lymph nodes, and the minute it spreads to your lymph nodes, it can get into your bloodstream. And the minute cancer cells get to your bloodstream, it has access to every part of your body, from your brain all the way down to your toes. Yeah. Which is why the minute you see something on your skin that doesn't look right, you're better off having a doctor saying, that's nothing, than being like, well, I don't want to be embarrassed. Like, some of you guys don't ask me questions, but yet you have them, because you're too embarrassed to ask what you think is a stupid question. Well, that's dumb. That's just stupid. It really, really is. If you have a question, you should ask it, right? If there's something on your skin that you're like, I don't know what the hell that is, that doesn't look normal, there are people who specialize in that. Ask them. Better having them say that's nothing than you wait like 6 months or a year, and then it turns out to be, then it's in your lymph nodes, and then it goes through your bloodstream, then it spreads, and that's when this becomes unmanageable. And we live in an area where skin cancer is something you should be concerned about. You should be concerned about skin cancer living in Houston. It is what it is. I've had it twice, and I've only been here for 20 years, right? I've had it twice. Again, I had the good kind. You know, I had the kind where they're just like, you're done. But then there's the bad boy of all. This is one of the worst cancers out there. This is called malignant melanoma. Malignant melanoma arises from melanocytes. Melanocytes obviously are the cells that give us our skin color. Melanocytes are ultimately what gives color to our moles. So when you think about your moles on your, like here I've got a mole, and your moles tend to be a little darker than the skin around it, right? And that's because that has a heavier amount of melanin. This one spreads very, very rapidly. If this cancer arises, this cancer will spread and grow and expand very, very, very quickly. This is a cancer, if they find it on your thumb, they remove your hand. They don't play. If they find this on your toe, they will remove your foot. And if they need to, they'll just cut you off right at the knee. Right? This is a very, very, very fast-growing cancer. And when you find it, they will take out a huge portion of your body. I had a gentleman, we found one on his back. They took out a section of his back about yay round. And then he had like this huge divot in his back afterwards, which is slowly, over like 2 years, being filled in by subcutaneous fat. But you could still, like if he takes his shirt off, you're like, dude, what happened to your back? And it's a big, big section like so. And they caught it early. They caught it really early. This is a dangerous, dangerous cancer. This is on my top 5 of cancers that I would say, don't give me that one. Because these spread really quickly. They get into our lymph nodes and ultimately into our bloodstream very, very quickly. When they do, they then show up on your brain, on your internal organs, things like that. And once that happens, now you're chasing something you're never going to be successful with. Thankfully, it only accounts for about 5% of the skin cancers. And when we take a look at malignant melanoma, this is malignant melanoma. And when you're trying to figure out, the one thing I tell people, if you want to try to get malignant melanoma under control, the easiest thing to do is start checking your moles. Your moles are where this is gonna ultimately arise from. And there's a simple 5-step process when you're looking at moles that tells you, hey, this is, this is a mole that's getting out of control, or this is a normal mole. Most of these cancers arise from a mole. So you have a normal mole like what I have here on my elbow. But if any of these 5 things begin to happen with any mole, that's when you just go to the dermatologist. They'll remove it just because. They'll just be like, let's just get rid of it. That way we're not thinking about it. We'll check the cells under the microscope and see how it looks. So asymmetry. Every mole on your body should be a nice concentric circle. Not this. And not this. Moles should always be nice and round, perfectly round, where if you cut that mole in half, in any direction, what you have is 2 equal halves. That's asymmetry. Or that's symmetry. So if they're asymmetrical, that's a mole you should remove. The second one is border. Your moles should have nice, smooth borders. So if you have a mole that kind of looks like so, that is not a smooth border. It's a little lump. That's a bad mole. They'll remove it just because. Color. Moles should have one color. Maybe it's brown, maybe it's black, maybe it's a color in between, but all moles should pick a color. It should stay consistently that color. If you have a mole with multiple colors, or it starts to change colors, get rid of it. Diameter. Your moles should never be more than 6 millimeters. What's an easy way to determine 6 millimeters? It's an easy product that most of you are probably carrying with you as we speak.
The pencil.
Pencil. A pencil eraser is 5 or 6 millimeters in diameter.
I think I have a
In each of my treatment rooms at my office, I have a pencil that's unsharpened. The only reason why it's in there is if I'm looking at somebody's back or skin or what have you and I see something, I just literally put the eraser on top of it. If I can see the moles surrounding the eraser, here's the dermatologist I recommend. Get rid of that thing. In fact, every skin cancer I've ever caught, diameter, the pencil eraser is what made me send them to the dermatologist. Just simple thing. And then eventually you see. And evolution. Moles should never change. The mole you had when you were 6 is the mole you should have when you're 26, is the mole you should have when you're 56 and 86. Moles don't change. If they do, you want to get it checked. Yes, ma'am.
I think I have a bad mole.
That's what dermatologists are for.
Okay.
Dermatologists, all right? Everyone living in Houston should have the name of a good dermatologist. All right? We live in a very, very bad area for sun exposure, especially in the summertime. We get hit with more UV rays than virtually anybody else in the country. And as a result, this is just a more pressing issue down here. It's not meant to scare you, it's really meant to educate you instead. I can tell you in my family, between my parents, my siblings, my wife and kids, and my grandparents when they lived here, I think we've had 7 skin cancers. All of them were basal cell, all of them, they scooped them out, we moved on with the day, but they do exist. And I've caught 3 or 4 malignant melanomas in 20 years of practice. Most of them are still alive, catch them early. But if you don't catch them early, these will spread real quick. Any questions on the skin cancers? Good. Don't ever worry about the developmental aspects of the chapters. All right, so that's the end of skin. The last thing I really want to talk about this morning, before we do the quiz here in lecture, I want to get into the beginnings of chapter 5. Some of what I'm about to talk about this morning might show up on Thursday's lab exam. Everything that I talk about today in lecture will show up on your lecture exam, which is a week from today. The stuff at the beginning of this chapter is really not that difficult. Right? It's really basic material. It's a basic introduction into the skeletal system. Again, I only want to go maybe 20 minutes or so, and then we'll be done. There's only a handful of different concepts, and then we'll move on to lab where we'll do our review. But again, everything I talked about this morning is fair game for Thursday's lab, and it definitely will be on next Tuesday's test. So, we think about the skeleton. Our skeletal system is ultimately composed of a few things. Obviously, our bones, the joints that exist between the bones, cartilage, which exists between the on the ends of the bones that make up those joints, and then the ligaments that support the joints. And our skeleton is ultimately subdivided into two. We have an axial skeleton and an appendicular skeleton. I thought I had a picture of that, but I did not. The axial skeleton. The axial skeleton includes our skull, the bones of our skull, the bones of our face, the bones of our spine, and the bones of our ribs and sternum. Basically, everything right down the middle would be considered our axial skeleton. Opposed to that, we have our appendicular skeleton. This includes upper and lower extremities, it includes something called the shoulder girdle and our pelvic girdle. And what we're going to spend, starting a week from today, we're going to spend at least 2 labs naming all the different bones. We'll start with the axial skeleton, and we'll name all the bones of the skull and face. We'll name all the bones of the spine. We'll name all the ribs and the sternum. And then we'll move to the appendicular skeleton and move from there. When we think about the functions of our skeleton, hands down, the best 2 are supporting the body. Our framework is ultimately made up of our skeleton. And our skeleton, we use it to protect soft organs. Our rib cage and sternum protect the heart and lungs. The spine protects our spinal cord. The pelvis gives protection to internal organs in our pelvic cavity from behind. We ultimately use our skeleton as the attachment site for our skeletal muscles. Yes, ma'am?
I can't really read what,
This
you
one?
said. Yeah,
Upper and lower extremities,
okay,
shoulder girdle,
okay,
pelvic girdle.
okay.
We do use our skeleton to attach our muscles so we can move our skeleton. We do store things in our bones. We store minerals. What's the big mineral that everybody knows you should intake a lot of to make your bones strong? Calcium, right? And you hear the commercials where calcium does the body good. We use our bones as a savings account, if you will, for calcium. The more calcium you ingest, we use calcium for a whole host of different functions in the body, but excess calcium, we store it on the bones in our skeleton. We also store fat in our bone, in the hollow areas of our long bones, in the place called our yellow bone marrow. And then last but not least, we use our bones as the area where we make all of our blood cells. Red blood cells, white blood cells, platelets, all of them are produced in our bones in an area called the red bone marrow. And the process of making our blood cells is known as hematopoiesis. We'll talk about that as we move along. Hematopoiesis we'll talk in greater detail when we get to the blood chapter in the second half of the course. But it kind of gets mentioned here as well. We ultimately have 200, yes ma'am?
Does milk still make your bones strong? Does
Does
milk?
milk?
Yeah.
Yeah, anything with calcium in it's going to make your bones stronger. Milk is not the only, green leafy vegetables and all that kind of stuff is loaded with calcium as well. But a diet that's high in calcium will make your bones stronger. We use calcium, when we get to the muscle chapter, we talk about how muscles contract, calcium plays a huge role in allowing muscles to contract. When we get to the nervous system, we talk about how a neuron fires. Calcium plays a huge role in allowing neurons to fire. So without calcium, those 2 things don't occur. But So when we think about calcium, we only think about it as making strong bones, when the fact of the matter is, that's the least of our problems. No calcium, you're not gonna contract muscle. No calcium, you're not gonna allow a neuron to fire, in which case you're in a hell of a lot bigger problem than if you have weak bones. But as we drink and ingest calcium, our body's gonna use X amount of it to do those other functions, muscle contraction, nerve firing, things like that. What's left over, your body will then put into the skeletal system and make our bones thicker. The thicker your bone is, the stronger your bone is, right? And then on the same token, if you go through a period of time where you choose not to ingest calcium, your body will actually take calcium off of your bones, put it into the bloodstream so that those other systems can use calcium properly, right? The problem is if you take away more calcium from bones than you add to the bones, your bones over time get weaker. We call that osteoporosis, right? On the same token, the more calcium you ingest consistently throughout your life, the stronger your bones will stay long term. Does that make sense? Hmm? We have 206 bones in the body. We will name all but about 20 of them in lab. The good news is there's lots of duplicates. You have 2 femurs, 2 tibias, 2 fibulas, 2 humeruses. So it's not 206 new names, but probably 100 of them anyhow. And then there's 2 basic types of bone. We have compact bone, which is the outer perimeter of our bone. And then in the center of all of our bones, we have something called spongy bone, which is what we see in this picture. As we take a kind of a cross-section of our skull, the center of our bone, what we see here, this is called spongy bone. And then on the perimeter of it, where we have this hard plate-like bone, this is called compact bone. And all of our bones are made up of a combination of hard, compact bone on the perimeter and softer, spongy bone on the interior. And the combination of these two is what gives our bones their strength. Bones are ultimately separated into 4 key groups. And they're separated based on their shape. And so when we think about these different shapes, the first one is a long bone. Where do you think we have long bones? Some good examples. Our legs. So certainly when you think about the bone of the thigh, the bones of our calf, our arm, both upper and lower, as well as our fingers. Our fingers and hand. These are all examples of long bones. These are bones that are longer than they are wide. And we find them in our extremities primarily. Short bones. Short bones are pebble-like bones. These are bones that are shaped like little pebbles. There's 2 areas of the body where we have short bones. Where do you think those are? Huh? Not so much the hand, but the wrist and foot. So when we think about the bones of our foot, which are called our carpal bones, these are examples of short bones. And then the bones of our foot, like our heel and the bones around our heel, they're referred to as short bones. The third type of bone is called a flat bone. Flat bones are going to be bones that, as their name implies, are flat. And flat bones are always protected. They're protecting some structure that's underneath them. So what are some examples of bones that are flat and are protecting something? Ribs are a good one. So the ribs and the sternum are both flat bones. And the skull. So definitely, and other bones in the flat bone, your shoulder blade. The shoulder blade is also a flat bone. Protects the back of our torso. And then last but not least, we have our irregular bones. Our irregular bones are bones that don't really fit into any of these 3 categories. These are bones that are oddly shaped. So they're not flat, they're not really long, they're not pebble shaped, they're kind of something else. So as a result, they kind of create their own category. So what are some of the odder shaped bones of our body? Spine is a great example. So the vertebra of the spine, certainly the bones of our face are very oddly shaped bones. Those are probably the two best examples of irregular bones. I think I have a picture of this. Yes. So when you think of a long bone, we're thinking of a bone that's longer than it is wide. We're generally going to be thinking about the extremities, either the upper arm or lower arm. We're going to be thinking about the bones of the hand and fingers, the bones of the front portion of our foot and our toes, as well as the bones of our thigh and our calves. These are all just longer bones. Short bones, on the other hand, these are bones that are kind of shaped like a pebble. We have them in the back of the foot, and we have them in our wrist. Flat bones are going to be bones, as their name implies, are flat, and these are always going to be protective in nature. So we're thinking our ribs and sternum, we think our shoulder blade, and the bones of the skull. And then the last category, which is kind of a catch-all, are our irregular bones. These are bones that are oddly shaped. They don't fit into any of the other three categories, so they created a catch-all category for them. Vertebra are a very good example, and the bones of our face are very good examples of our irregular shaped bones. They do occasionally on the lab exam ask this question. They'll ask a question about the four different bone categories, and they'll ask you to name a bone that fits one of the categories, or they'll give you a bone, but they'll give you its generic name. So they won't call it the humerus, they'll call it the bone of your upper arm, or they won't call it your scapula, they'll call it your shoulder blade, something that you probably came into class already knowing, or they'll call it the bones of the spine. They'll pick a term where you'll know the bone they're talking about. And if you don't, raise your hand and I'll point to the bone on a skeleton. The last real thing I do want to talk about, this is just going over it all over again. And this one they love to ask. They love to ask, and this will definitely be something I ask you on the lecture exam, are the parts of a long bone. We love to dissect the parts of a long bone. And when we think about the long bone, and they're picking our humerus here, all of our long bones have a general shape, something like so. And our long bones have a couple of different key components. First off, there's a couple sections. All of our long bones have a shaft, and the shaft of a long bone is called the diaphysis. So that's the shaft of the bone. And on either end of the bone, we have the end section of our bones. This is known as the epiphysis. And the epiphysis of our long bone, whether you're talking about the proximal or distal epiphysis, this is going to be where the cartilage for that joint exists. So this is where you're going to see the cartilage for the joint. In particular, this will always be hyaline cartilage. And this dotted line, which ultimately separates the epiphysis from the diaphysis, this dotted line represents one of two things. This is either going to be the epiphyseal line, or it'll be called the epiphyseal plate.
What is its function?
That's coming. Now, there's a big difference between the epiphyseal line and the epiphyseal plate. What do you think that the difference is?
One's growing and one's not.
One's in a growing bone and one is in a non-growing bone. The epiphyseal line, which is what we see here, we see this in adults. And the epiphyseal plate, we see this in children. And the epiphyseal plate is in a bone that is still growing. In children, what we see where those dotted lines are is a line of cartilage. And it's known as the epiphyseal plate or the growth plate. And that cartilaginous section of a long bone is what allows for that bone to ultimately get longer as that child grows. My son Jack, when he, maybe 2 years ago, was about 5'8". He's now 6'4", right? He went from 5'8" to 6'4" in 2 years. The reason why that is because his long bones had cartilage where these dotted lines exist that we refer to as growth plates or epiphyseal plates. And then when he went through his growth spurt, right, that epiphyseal plate produced more cartilage, which ultimately got turned into bone and allowed for the bones of his legs and arms to get longer, and he grew up taller, right? On the same token, I haven't grown an inch in years, and I don't plan on growing taller anytime soon. Ultimately, what happened to me, and what's happened to almost all, if not all of you, is that area where I used to have cartilage, now has turned into a solid scar, if you will, of bone, which we refer to as the epiphyseal line. So if you took an x-ray of my humerus, what you would see is one giant solid bone. But if you took a picture of my 13-year-old's humerus, what you would see is that it looks like he has a bone here, a long bone here, and a bone here with nothing in between, because cartilage doesn't show up on an x-ray. And what he still has there is his growth plate. We refer to the growth plate as the epiphyseal plate. Everybody kosher with those few issues? Good. All of our long bones are hollow. So as you look into the center of our bone, the center of our bone is hollow, and this hollow area is known as the medullary cavity, which is the hollow center of our long bones. And there's two reasons why we have this cavity. The first one is we store fat here. So within our medullary cavity, we store fat. We call this the yellow bone marrow. What's the other reason why our bones are hollow? Don't get me wrong, it gives blood vessels access, but we get blood vessels getting access through the compact parts of our bone too. Think about a bird. Why would a bird want to have hollow bones?
So you can fly.
But the only reason why they can fly is because their bones are what?
It's light.
They're light. The hollowness on the inside of our bones make our bones lighter, significantly lighter. If our bones were solid all the way through, we'd be significantly heavier, to the point where it would be very, very difficult for us to get around and do the things that we do and take for granted. So the hollowness of the bone, not only does it provide the bone with a place to store fat as yellow bone marrow, but this also gives our bones a little bit of reduction in weight, which gives us a greater ability to be functional. On the contrary, when you think about the inside of our epiphysis, this area is where we are going to have our red bone marrow. And this is where we produce all of our blood cells. Red blood cells, white blood cells, platelets, all of our bones, all of our blood cells are produced in our red bone marrow. Our everybody chose you with these two concepts. And then last but not least, can I erase all this? These,
yeah.
Our bones are surrounded all of our bones are surrounded by a thick outer covering. And this thick outer covering is called the periosteum. This word we see here, we can see the periosteum being peeled away right here. The periosteum, imagine if you created, if you made yourself a sandwich and you surrounded that sandwich by saran wrap. Right, that saran wrap protects the outside of the sandwich. Right, it makes the whole sandwich package a little stronger. That's the job of the periosteum. It completely surrounds our bone. It allows for the bone to be stronger. So it makes the bone stronger. Especially when you consider attaching itself to our bones is muscle and ligament and tendon, which are constantly tugging on the bone. And the one thing we don't want is as we contract the muscle, for us to rip the bone off of itself. That's known as an avulsion fracture. So the periosteum helps to protect it. Furthermore, our periosteum is lined by a special type of cell known as an osteoblast. And osteoblasts help us to make bone. So when we take a look at on the bottom half of our periosteum, we have a series of cells called osteoblasts. And osteoblasts make bone. So as we want to make our bones stronger, there are specialized cells that exist on the underbelly of our periosteum, which will add the bone to the outside of our bone, making our bone thicker. Those are known as osteoblasts. Lining the inside of this cavity. So lining the inside of this cavity, represented here in red, this is called the endosteum. So it lines the inside of our cavity. It doesn't really make our bones stronger, but it is lined with a cell, a specialized bone cell called osteoclasts. And osteoclasts destroy bone. So if we want to make our bones thinner, we use osteoclasts, and they will take bone away from the inside of our bone and dump it into our bloodstream. So here's the scenario. We have two people. One who loves to drink milk and calcium and the nutrients that help make bones stronger, and another that doesn't. Both of their bodies require calcium in order to make muscles contract, require calcium to make the nervous system function properly. The one who drinks excess amounts of calcium will feed those organ systems just fine with all the calcium in their diet. And then whatever's left over, they'll store that calcium on their skeleton, making their bones thicker and stronger. The bones get thicker and stronger because osteoblasts take that excess calcium, add it to the outside of the bone, making that bone thicker. The person who doesn't drink enough calcium, doesn't eat enough green leafy vegetables and things that bring in all the nutrients necessary to make the bones stronger, their nervous system still needs to function. Their muscles still need to contract. They're going to get the calcium from somewhere. The way they will do that is they will take out calcium from their bone, making their bones thinner, but providing calcium to the other organ systems, because what's more important, having a strong bone or being able to contract muscles and cause the nervous system to fire? Muscles and nervous system is more important, right? Your body will always choose muscles and nervous system, always. Even if it means you have the weakest bones on the block. And ultimately, we make bones thicker and thinner using these two cells, which are found in these two different parts of our long bones. Any questions on this stuff? Good. This is just giving a closer look. We can see that periosteum surrounding the outside of the bone. Again, this periosteum is lined with those osteoblasts, which help to make our bones thicker. We can see the endosteum here, ultimately lined with those osteoclasts, which we use to make our bones thinner. Here's the other thing. Everybody here knows who Tom Brady is, correct? Or Patrick Mahomes, since Sunday was the Super Bowl. What bone in Patrick Mahomes' body is probably bigger than the exact same bone on the opposite side of his body? Bottom right.
Oh, his throwing arm?
His throwing arm. I guarantee you, his bone in his upper right arm is bigger than the bone in his upper left arm. And why is that? Because he uses this one 1,000 times a year to do this motion with a lot of force. And the muscles in his right arm, I bet you, are a little bit bigger than the muscles in his left arm. So as a result, because he overuses this right arm, this bone, the bone in his right arm, gets thicker to accommodate it. Does that make sense? It's not that this one gets thinner, but he's going to make this one bigger. Everybody here knows who Usain Bolt is, right? What bones in Usain Bolt's body are a little bit bigger than they otherwise would be? His legs, especially his thighs. Because he's I don't know if he's the fastest man in the world anymore, but for a long period of time, he was certainly the fastest man in the world, right? Overuses it, we make the bones thicker. And this is all just showing the same stuff that we've talked about. Epiphyseal plate, epiphyseal line, endosteum, all that stuff is right there for you to look at later on. All right, everybody take everything off of your desks.